Hello again, this is Amy Yost, and I'm going to walk you through the Ophthalmic Technology Program Handbook, just so that you have a really good understanding of what the content includes. You certainly should be able to review this at any time, either by videos or by looking through the handbook itself. I'm going to break this up into 8 smaller sections just so it makes it a little bit easier to keep track of everything. I do want to note that this is the acknowledgement statement, which you'll find at the very end of the document. So we want to make sure that we get that taken care of. Once we do a full review, then you're going to fill this out. You'll fill in your name here. It says I, fill in your name. If it was me, I would say Amy Yost, have received a copy of the student handbook, la-di-da, read the rest, and then you can sign and electronically sign and date it, and then submit that back to me at amy.yost@mercycollege.edu. Okay, so let's go ahead and get started with the rest of the handbook, and that is, hold on just a second, let me pull it up right here. Okay, so as we go through this, I'm going to start out by just going through a couple of these first few sections here. Oops, a little too far. The Ophthalmic Technology Program, we are here to welcome you and to introduce you to the world of ophthalmology. If you do have experience in ophthalmology or in the medical field in any way, that will be a great help to you. If not, which most people are not when they enter into the Ophthalmic Tech Program, we are here to teach you from the ground up. I assure you that our instructors are here to help you learn about ophthalmology, the terms, the abbreviations, various eye conditions and medical and surgical treatments, as well as the exam procedures to help the doctors and physicians, the nurses, to be able to treat the patients with eye problems. So we certainly welcome you into the program. The purpose of this handbook is to familiarize yourself with the policies, the procedures, not only for the labs, but the online courses and also your clinicals that you'll be experiencing in the springtime. I certainly encourage you to look through this handbook in quite a bit of detail on your own, as I will just be highlighting a few things, okay? Just one quick disclaimer, there are lots of guidelines and policies that the college will provide to you. The course catalog has a lot of information about the college and a lot of the policies and services available to you as a student. So I encourage you to not only read over the program handbook, but also the course catalog, as it includes lots of very valuable information. If there is a conflict between the two, in other words, if it's stated, if a particular topic or description is stated one way and the handbook is written another way, the course catalog typically is the one that has the overarching correctness or trumps the handbook, if you will. There will be changes to the program handbook from time to time as needed. We try to make all of our edits before posting and before creating the videos, so we certainly hope that there won't be any changes, but we will inform you if there are. As far as program retention and criteria or the standards of progress, the program's dismissal and course repeat policy is found in the course catalog. Hopefully that won't pertain to any of you, but if you do need that information, it is in the course catalog. Programmatic accreditation status. So the program itself is actually accredited through several layers of accreditation, but the one that's specific to ophthalmology is the International Council of Accreditation for Allied Ophthalmic Education Programs. That's a mouthful. So we refer to it as ICA, and their logo is actually ICA. And in fact, we just had a site visit, an audit, if you will, in the spring of 2018, back in May, and there were no findings. In other words, we were in compliance with everything, and while they did have a few suggestions for improvement, which they always offer, of course, we were found in very good standing, so I'm very proud of that site visit, and the accreditors were actually very impressed with our program. The hybrid program is actually very unique, and the accreditors actually may be interested in talking to other programs about creating that hybrid program where there's a combination of the online ophthalmic programs that goes hand in hand with the live programming in the lab. So be very proud of that you are part of that. Oops. Gotta figure out my mouse here. Program goals and learning objectives. So we certainly have goals in mind. We want to see you succeed. We want to help you find a position in ophthalmology. You know, that is the goal. We want you to graduate from the certificate program. We want you to sit and pass your COA exam. So we're going to do what we can to facilitate your success. Of course, a great commitment is needed from you as you commit to the classes, commit to the assignments, and doing what you need to do to help you succeed as well. But this is a team effort, and we will do our part in that. We want to make sure that you're prepared, as this says, prepare competent entry-level ophthalmic technicians in cognitive, which is the knowledge. So we're going to teach you a lot of things, terms and abbreviations and conditions and things like that. Skills in your labs, you're going to have that hands-on. How do you perform this particular skills? We're going to help you get through those things. And then behavior, learning domains. In other words, we're going to help you to think. If you have this situation, you may need to do this. If you have this situation, you may need to do that, and things like that. And while in 2 semesters' time, we can't teach you everything, we're going to do our best to teach you a lot in that very basic, get you the basic fundamentals that's going to help to build as you enter in the field of ophthalmology and then start your career in ophthalmology as well. We want to make sure that you can demonstrate technical competence when performing ophthalmic procedures. So again, we want to make sure that you are able to perform basic level skills in ophthalmology, and we will get into some intermediate and introduce you to some advanced level skills in ophthalmology, but in the labs, but also in your online courses, you're going to understand not only the concepts, but how to perform. It says demonstrate responsible, ethical, and professional patient care. Okay, so we're going to talk about not only how you go through the motions and perform the functions of a technician, but also the important things that come along with healthcare, respect for your patient, confidentiality, respect for the family members that may also be accompanying the patient. There's a lot of things that go into that, making sure that you do things ethically and document well. What else? Employ components of effective communication. So, of course, as you're dealing with patients, you're getting information from them, you're asking them questions, they're replying, you're documenting that information, you're also communicating with the doctors, your fellow technicians, their surgery schedulers, perhaps the labs in another facility. There's a lot of communication that goes on verbally, written, and as well as perhaps electronic data entry. So we want to make sure that you are developing effective communication. Apply an understanding of scientific and mathematical concepts to eye care situations. So going back to the critical thinking, we want to make sure you understand the background in ophthalmology and be able to make some decisions on that. And mathematically, there's a lot of math in ophthalmology, and some of it's basic level math, maybe some algebra that you'll be using in ophthalmology, but it's fairly common to be using a lot of math in the ophthalmic practice. And we'll get into that as you start your labs and your clinicals. Demonstrate the ability to solve problems and think critically. And I think I've mentioned the thinking critically several times already. We want to make sure that you're seeing the big picture for what it is. You don't forget that that patient is actually a person and that you treat them kindly and fairly and professionally, and to be able to make decisions based on what you know and what you need to have accomplished based on the doctor's orders, but also to treat that patient as a person, making decisions as you go along in their workup. Okay. As far as program assessment plan, there's going to be a lot of assessments that go through, and you could read through all of these, but I can just let you know, to summarize, that there's going to be a lot of assessments. We assess how well the program is going. We assess how well you feel the learning techniques provided to you are working for you. We assess how are the instructors, how is the online, how are the labs. Later on, we will also assess how were clinicals? Were you prepared for clinicals? After clinicals and you graduate, were you prepared for graduation? Were you prepared to sit for the COA exam when it came time for that? Your COA exam is the Certified Ophthalmic Assistant exam. And once you complete this 2 semesters of the certificate program, you will then be eligible for the internationally renowned COA exam, which is recognized everywhere in the US and also in many countries internationally as a level of certification that says, yes, you know a certain level of information about ophthalmology and you are certified in that. So you can see there's a list of different assessments that we will go through. Okay, I'm going to stop there. We're going to take a break, and I'll pick up another module in just a minute. Thank you.